Okay. All right. Good afternoon, everyone. Thank you for joining our webinar today. This is a part of our webinar series that is centered around Albanian excellence. So this webinar series explores different themes. Today, we're going to explore dentistry. Our webinar is titled Insights into the Dental Profession, Career Paths, Challenges, and Success Strategies. So it's my honor to join Irena today, who was our organizer of this event, the guest speakers who are here today, as well as it's my honor to moderate this discussion. My name is Ray. I was born in Albania, in Fier, and I've been in North Carolina for around 10 years. I graduated from UNCC in 2023, and I will be attending medical school this July at Wake Forest University School of Medicine. I currently serve as the vice president and the college mentorship initiative under SAPS, and I'm joined by Irena. Irena, you may introduce yourself as well.
Hi, everyone. My name is Irena, and I'm so excited to be your host today for today's dental webinar. I was born and raised in Michigan, originally from Korcha, and I am currently a pre-dental student at Florida Gulf Coast University, and I live in Naples, Florida. I'm majoring in health science and minoring in chemistry. And aside from that, I also work as a pediatric dental assistant. I've been that for 2 years, and I'm involved in several leadership and mentorship roles on campus and outside of campus. So I'm a part of the SAPS Webinar team, a student mentor for our college initiative program, and the founder and president of the Albanian American student organization, ASO, at FGCU.
All right, thank you, Irena. Before I allow Irena to kind of take over and start this webinar, I want to spend the next 2 to 3 minutes to briefly discuss about the organization behind the webinar. So we are SAPS, which stand for Shoqata, Akademike dhe Profesionale Shqiptare. Our goal is to foster academic excellence and professional advancements for Albanians in the US, but also in our diaspora. We do so through two main initiatives: our high school mentorship initiative, which aims to connect college students with high school mentees, and also our college mentorship initiative, which in its core has our webinar series, which our webinar falls under that. Our high school mentorship initiative offered last cycle personalized mentorship, comprehensive guidance, and community building. We had mentees from 11 US states through 21 US high schools, as well as 8 high schools from Albania and Kosovo. We had 45 mentors from 33 US institutions across 20 US states. After our in-person event in Washington, D.C., we noticed that there's a large number of Albanian professionals in the U.S. They wanted to help us out, but there was a little bit of logistics issues to bring them in the same room for in-person events. So we thought that, what's one way we could do that without having in-person events? And one thing that we thought about was to have a webinar series. This webinar series essentially will highlight different themes and different industries, so law, medicine, dentistry, engineering, technology and data, finance, and much more. Our goal is to offer students an opportunity to develop their profile, but in its core, we're an organization funded by college students. And one of our main goals is to engage students culturally with professionals who are not only successful, but come from an Albanian background. And then I want to allow Irena to briefly discuss a little bit about our webinar team.
So me and Ray already introduced ourselves, but I just wanted to let you guys know that we also have a big team behind us. So we have Clea, who's our event coordinator, Jenny, who's our marketing director, Dafina, who's our engineering lead, Adem, who's our technology and data lead, Eranta, who's our research and academia lead, and Diana, who's our medicine lead.
All right, and we're going to start the webinar. This will be the main theme of our webinar today. Hopefully, we offer some insights into the profession to whoever is listening to this webinar. These insights can be career paths that you can take, challenges, but also we want to spotlight success strategies. Both speakers who are with us today, I want to shout them out before Irena introduces them. They're both very successful and in tune with the Albanian community. So we're very honored to have them today. This webinar, I want to go over a few rules of decorum. So what will happen is Irena will introduce both speakers, starting first with Dr. Doku and then with Dr. Miraka. Dr. Doku will have the first 20 minutes to do his remarks, and then after he's done with his remarks, we'll introduce Dr. Miraka, who will do the same. After both speakers have done their remarks, we'll have a Q&A session, which will allow both speakers to interact with one another and answer questions from the audience. So without further ado, for interest of time, I'm going to allow Irena to introduce our first speaker.
So I'm honored to introduce our first speaker, which is Dr. Rezan Doku. Dr. Doku is a practicing general dentist who brings not only clinical expertise, but also a deep passion for mentorship and community engagement. His journey through dental school and into practice has been shaped by his dedication, resilience, and commitment to patient-centered care. We're so excited to have him with us today to share his experiences, challenges, and advice for those of us who are just starting this path. So welcome, Dr. Doku, and thank you so much for being here.
Thank you for having me. Okay, so I'll go ahead and get started. Thank you guys for joining. I'm going to delve right into it since we don't have too much time, but I came to America when I was at a very young age. I was born in Albania. I immigrated here with my grandparents, and we did a lot of moving around actually. So when we came to the United States, we lived in Hamtramck, we lived in Detroit, Warren, Sterling Heights, moved all the way to Florida, where Irena is. I came back to Sterling Heights as well too. So, adjusting to the culture, assimilating to everything that's completely different here. And I kind of looking at it from a perspective now, because I'm in Rome currently, seeing how the lifestyle is here, how it was in Albania, how it is in America, it's totally different. And it's kind of just put things in perspective to where we are today. So yeah, definitely very, very hard to adjust initially. Just kind of give you an idea of how Albania looked back then. I know it's changed a lot to what it is right now. Let's can go to the next slide. So my inspiration. So at a very young age, I did lose my parents, but grandma and grandpa stepped it up and they put us to where we are today. They took initiative, brought us to America. My siblings here to the left, as you can see, did everything they could to help me where I am today as well. They also served as a mother and as a father figure to bring me where I am today. So a lot of challenges financially, in every aspect of things, coming from a former third world country to where we are today, we sacrificed a lot. And let's go to the next one. So the biggest things that I want to mention when, undergrad, high school undergrad, and getting into to Detroit Mercy Dental where I went, it was a lot of struggle because we didn't have anyone to really get the guidance, finding the balance, for studying, knowing what classes to take, when to take them, all of those we had to pretty much find on our own. And I didn't start off with the best GPA too. I had to overcome a lot of hurdles. So it wasn't the easiest route that I could take myself. But the challenges that I faced and being able to excel afterwards made it really worth it for me. Also too, because my siblings, especially my brother, he owns a dental laboratory. He needed to find a pathway because he opened up his own dental laboratory. I had to go back to school to work. So going back to work, my sister working as well too. We had to do everything that we could financially to put him where he is today. So I was out of school for a very long time. So about like 4 years. So I had to relearn everything. I had to relearn for the DAT. Actually started a master's course. I didn't complete it because I got into dental school, but a lot of obstacles that I had to face before I even got into dental school. We'll go to the next slide. So to give a perspective, I did a lot of work with, I worked at restaurants, served a role as a dishwasher, as a busboy, did landscaping, drywall, electrical, you name it. And I participated a lot too. So I worked at St. Vincent de Paul as well. I really wanted to see if the dental field were something that was something that I really wanted to do. So I was an assistant as well too. Um, and I also, one of the biggest things that really helped me was I worked in telemarketing. So in dentistry, you have to be good with your hands. You have to be able to communicate with your patients really well too, because you have to convey the message. You have to make sure that they understand you. And more importantly, they have to be very comfortable with you. So with the telemarketing, with sales and everything, it really enabled me to connect with my patients current day, and it's made my life much easier to be able to convey that, because you can be the best dentist in the world if you're not able to have that communication and talk to your patients and see eye to eye with them, you're not going to be able to see as many patients as you should. I also wanted to mention too, not the traditional route, is I retook the DAT many times. So a lot of times, even I own Macomb Dental Group, so I have a lot of assistants who are wanting to become dentists. They want to start dental school. And a lot of them have this fear that, I want to take the DAT, I want to do really well. Nobody wants to retake anything. But I did, and we were able to still push through and get into dental school. Go ahead and take. So I attended Wayne State University. I took a couple of classes at a community college. So like the reading comprehension really helped me with when I took the DAT for that. And I also went to Oakland University. And as I mentioned before, I did start a master's program. I want to elaborate a little bit here with meeting with the dean of the school. So during the time where I was out of school for a little while, the school wanted to really see, can this person handle the workload? Can they comprehend it? Can they do well in dental school? Because they're investing in us too. And dental school is not cheap by any means. So when I first started my master's program, I was at Oakland University. And when I met with the dean at Detroit Mercy, he had mentioned that they don't really favor that program. So I decided to enroll at the Wayne State School of Medicine, start that program there. And I made sure that I got a hold of the people in admissions to let them know that I was doing very well with my midterm grades, and I was actually able to get an interview there and finally get accepted. Go ahead. So kind of fast forward to life after dental school. It's still something where it's a work in progress. You need to make sure that this is you have the passion for this, because you will take continuing education courses. You do need to have a certain amount of credits in order for you to maintain your license. And you also want to be able to be good at what you do, because if you're good at what you do, you're going to be confident in what you do and you're going to do a ton of it. If you're not confident, you're going to shy away from it. And a lot of times, some dentists will make the wrong decisions, or because they can't do a certain procedure, they may have you do another procedure that may not be the best for you. So I started taking courses for root canals. I became very good at it. I do a lot of root canals. Took courses for implants, Invisalign as well, that I didn't mention over here. But with experience, of course, practice makes perfect. Another thing too, I'm always driven. I'm on overdrive. So after graduating dental school, I always wanted to open up my own practice, and I finally achieved that. But this is something that's self-fulfilling for me, because I wanted to be able to practice dentistry, but also kind of merge business with it as well too. And you have to maintain a good routine. So a good routine that you're going to have even in undergrad, even in dental school. It's something that's going to translate later on in life during practice, what you're going to do or what you're going to become. Go ahead. So practice ownership that I mentioned, in 2023, we opened up Macomb Dental Group, which we term as de novo, meaning a brand new practice. It had 0 patients at the time. And of course it was a challenge, but with everything else, it starts off as a challenge. So we've been in business since October of 2023. We have over 15 employees, and we actually acquired a second location, a second office in Dearborn. This one is in Sterling Heights, so a total of close to 50 employees that we have. I partnered with a friend of mine that graduated dental school at the same time, and we've just been growing the business since. And Bleginas actually came and helped out before for us as well too. We'll go to the next one.
He has a beautiful office. So just want to add that.
Thank you. I put a few pictures here, just not to show off anything, but really it's just to kind of show that we do change people's lives. So this right here on the upper left, it's Invisalign before and after. It's not so much so just aesthetics. You have to also look at it function as well too. You know, straight teeth, as they say, are clean teeth. On this second one here, I wanted to just provide a little bit more information to show how you change somebody's life. So this person that came in, when they first came in, they would not even look at me in the eye. They looked very down. It almost came off as if they didn't really want to talk to me. But I took my time to get to know them, to talk to them, see what their concern was, and no judging, of course. And little by little, we were able to help her. You know, we did root canals, we did fillings, we did crowns. And by the time she came in, you can see it's a brand new smile. She would come to the office smiling when she would come in for her cleanings. She would say hello, talk to me, chat, a lot more chatty. She got Botox done. So her self-confidence was, I mean, it was beautiful. Like she went from not wanting to talk to anybody to just talking to the whole staff. The third one here is just, you know, we get a lot of patients who are from Albania. They get work done in Albania and they don't trust work in Albania. So they come to us and they explain what's going on and they want to change their smile. So that's exactly what we do. And then the last one here, we did an implant in the front there. They were wearing this partial here that you can obviously see looks like it's out of place, but we replaced it with an implant. So definitely changing people's smiles and their life. Go ahead. So I encourage you guys to, whoever's interested in dentistry, to really do your research, to not just shadow one dental office. You really need to just get a perspective because everyone is different. We get a lot of students who want to shadow, and you know, I hear comments like, "Oh, you treat people differently, and you're so nice to everyone, XYZ." So, and it puts things in perspective because some people that do dentistry may not be happy, you know, and so that doesn't really encourage you. So, really, just shadow doctors, even shadow a dental laboratory. If anybody's in the area, as I briefly mentioned, my brother owns a dental laboratory, which is Avenir Dental Studio. We're actually the biggest lab in Michigan, but it gives you a good perspective of what goes on in a day-to-day. It's not always, you know, fast and easy to manage situations. Of course, you're going to have your complex situations, but you have to be able to push through and manage and do the right thing. And you can see a different perspective. If somebody's working at a laboratory, it's nice because you can see how the crown is made, right? So, or how the dentures are made, how the teeth are set. You're going to see all this stuff in dental school, but now you can get an idea of what's going on and you can kind of put the pieces to the puzzle together.
Oh, Irena was the student who organized the webinar, so I want to allow her to briefly talk a little bit about, you know, why she wanted to organize this. And then after we do that, we're gonna allow Dr. Miraka to do her remarks, and then we're gonna come back
Okay.
together because we have so many questions. I have so many questions here, Dr. Doku, that we needed you to elaborate on. So it's gonna be a good conversation. But Irena, if you want to do a little bit of your remarks as well.
Yes, thank you, Ray. Yes, I just want to take a moment to share why I wanted to organize this dental webinar and bring everyone together today. As a pre-dental student myself, I know how overwhelming it can feel trying to navigate through the journey, especially when you're trying to figure out what the profession is really like or what steps you should be taking to get there. So I helped create this event because sometimes all it takes is honestly just one honest conversation or one encouraging insight and one shared experience to help a student feel seen and inspired. So I hope that this webinar is the space that gives you and gives anyone the direction, inspiration, and maybe even that one piece of advice that pushes you forward.
Okay, thank you, Irena. And then we'll allow Dr. Miraka to do her remarks as well. And Irena, you may introduce her.
So I'd like to introduce Dr. Regina Miraka, and Dr. Miraka is a compassionate and dedicated dental professional whose journey in dentistry reflects both academic excellence and a deep commitment to patient care. Her work highlights the importance of empathy in clinical practice and the value of strong mentorship in shaping future dental professionals. So we're so excited to have Dr. Miraka here with us today to share her story, the lessons she's learned, and her perspective on what it means to be a provider in today's dental field. So thank you so much for joining us, Dr. Miraka.
Thank you for having me. A little disclaimer, I was not as prepared as Dr. Doku. No pictures, I'm sorry, but I'll try my best to paint a good one. I'm actually in the process of changing jobs and kind of weighing everything. So, but I was born in Albania, left Albania at about 5 years old. Then my family, we became refugees in Belgium for about a year, eventually immigrated to Michigan, and I was raised here for most of my life. Went to OU for undergrad, got my bachelor's in health science, and then got into dental school at Midwestern in Illinois for my doctorate in dental medicine. Go ahead. So dental school, my path was a little different. I've always wanted to be a dentist since I was 5 years old, so there was no other consideration in my head. Do I recommend exploring things? I think always. You should. But in undergrad, I worked as a dental assistant during going to school. So I got really good at doing insurances and front desk. So he really didn't want me to assist as much. I would spend my mornings finishing all my insurances and everything and then study in the afternoon. But that opened my eyes to kind of like considering opening a business and everything. Once I applied to dental school, I took the DAT once and didn't do so good. But I was determined to accept whatever came my way. I was a little disappointed not to get into a Michigan school at the time, but life in dental school was awesome. As somebody who was raised in a really tight, strict Albanian home, I got the ability to kind of grow out of my comfort zone, learn to cook, survive on my own, make friends from different cultures. When I was at OU, I was vice president and president of the Albanian American student organization. So my community was mostly Albanian. I didn't have much experience with other cultures and, just different people, which is a skill you have to learn as a dentist with patients, being from all over and different personalities. I graduated during COVID, and that was the wildest time ever. Would not recommend graduating during COVID as a dentist, but I started off with, big corporation, and I thought to myself, what did I get myself into? We've come a long way since then, but this is like some pictures from, first day of sim clinic here on the right and graduation pictures on the left and everything in between and all the people that kind of got me through it. Then I came home, like I said, during COVID, and did a few like top jobs, could not find a home for me. And was questioning whether I liked dentistry or not. You kind of don't realize what you get into. You think I'm an extrovert, I'm social, I'm good with people. Why is it not going to be good? Because it's more than that. It is managing. It is, you're the leader now. All of a sudden you went from being a student to leading a team plus managing patients. So leadership, I started reading leadership books and just kind of working on not just my dentistry. And like Dr. Doku mentioned, like lots of CE courses to maintain your license, gain skills, gain speed. All that are some obstacles that we kind of run into, but I made sure to join a lot of like the Michigan Dental Association and the ADA and get courses and meet and network with other dentists to see kind of how they managed that time, the stresses and the obstacles they ran into. So then eventually I started working with a really big corporation, and I started climbing the ladder there. And that's where now I have decided not to move forward with a partnership with them and am exploring biological dentistry, which is a holistic way of practicing medicine and dentistry. I myself ran into health issues, inflammation, GI problems due to kind of overly processed foods and everything in between. So that made me seek alternatives, and had the opportunity to cover maternity leave at a biological dentist, and I liked them and they liked me, and eventually was offered a full-time position with them that I start on Monday. So I'll keep you all updated. But now I'm weighing the options of, partnering or buying it. So a lot of this opportunities in dentistry, honestly. You can take it and go towards academics. You can go towards I'm doing holistics, partnership, ownership. There's really a lot of avenues to find it. So I went from questioning whether I want to even be a dentist anymore my first couple years out to, okay, how deep can I go into this, and what can I own and what can I learn? Exploring different worlds of it. So that's kind of where we're at.
I have a question for you. Is it with
Yeah.
Dr. Katzis?
No, is that with Dr. Russo? He's in
Okay.
Bloomfield.
Okay.
Yeah.
Nice. Congratulations.
Thank you.
Congratulations. Thank you for sharing. I know when you start something new, it's, exciting. So hopefully everything goes well. Um,
Thank you. Thank you.
I'm gonna continue to let you do your remarks if you have anything else you wanted to add, but we have so many things prepared. So either way, just let us know.
No, I'm good to go.
Okay. All right. Then what I wanted to do is, when we met as a team, we have a lot of students who are kind of in the verge. They don't know. They know they want to do healthcare. They don't know if they want to do medicine versus dental school. They don't know if they want to do pharmacy. I know Irena was one of those people who, like, going in, like in high school, she was set to do pharmacy. She was like, I want to do pharmacy, and then like she changed completely to dental school. So I think this is something that it's worth touching as a subject. Why did you decide to do dental school for both of you? I guess we could start with Dr. Doku, and then we'll go to Dr. Miraka as well. But what specifically like drew you to the profession? Was it something specific, or did you know in the beginning that you wanted to do this at all times?
It was so my grandma inspired me. She's had dental issues throughout her life. And when we came to America, I would go to all of her dental visits because I would translate for her. And it was kind of instilled in me as I was young. So but it was never forced upon me. So although I wanted to do something medical related, just like you had mentioned, this is where I said, you know what, it was actually a co-op. So I went to Sterling Heights High School. They have what's called Career Preparation Center. And they gave you the option to either do like dental careers, you can do nursing. I decided to do dental careers. And with that, I got a job with them. So I worked at a dental office, which was a pediatric dental office. I started off doing sterilization, and then I was an assistant. So with that, actually, because I needed braces at the time, they offered me braces like pro bono, so it was free, and it kind of opened up my eyes. And then I was doing a lot of, a lot of volunteering, and just kind of solidified why this is something that I saw myself doing. But again, initiated by my grandmother and solidified by myself.
Awesome. And Dr. Miraka, if you want to uh, weigh in a little bit.
Yeah. So I wanted to be a dentist as long as I can remember. My aunt in Albania was a dentist, and everyone always said I'm so similar to her. So in my mind, that meant I'm also going to be a dentist, and that stuck with me. But throughout exploring the field, in high school and college, and being a dental assistant and seeing a lot of lack in education on oral hygiene, the importance of it, and myself not knowing, and our parents really not understanding that brushing twice a day is mandatory, and so is flossing at least once, right? I had root canals as a young kid, and I just remember being in this office, and the dentists were just so kind, and I'm like 12 at the time, and I told them I want to be a dentist, and I remember them just like putting the gloves on me and, play pretend. And I just stuck through that and just wanted to change, I guess, people's lives. That was the goal. The medicine seemed a little bit harsh to me. The hardest thing I feel like I have to say to a patient is you need a root canal, which they take pretty bad. But it's not anything too crazy, like, terminal or anything like that. So that's kind of how I discovered it and stuck with it. Yeah.
Awesome. And then another thing that, I always wanted to ask people, regardless of what career you are, how prepared you are, there's always, times where you quote unquote hit a wall, especially if you're someone who's been successful like throughout your life in high school, college. Most people who go to post-secondary schools like dental or medical school, they've been academically gifted up to a certain extent. So I wanted to ask you, was there a time where you you know stumbled or faced some setbacks, and how did you overcome those, especially early on? And what are some lessons that you can share to people who perhaps are in your shoes now in their stage at their career?
Yeah, so I mean, overcame a lot of hurdles, from the beginning, whether it was learning a new language when you first come here, in high school, being focused, staying motivated, uh, having to retake the DAT, not doing so well. Um, you always have to make sure that you stay on the ball and you don't let anything distract you. There will always be distractions. You're always going to want to enjoy, I don't know, just simple things like going out, enjoying the sun or what have you. But you got to make sure that you study, you do really well, and you have to have a good support system too. So like my siblings, my grandparents, always there for me. And I had a common goal. So that was, you're always going to face challenges. Even today, even, owning two practices, there always will be something. You have to look at it with a solution in mind. You can't just think problem, problem, problem. You have to come up with solutions, and you have to stay dedicated, motivated, um, and never give up. If this is something that you're passionate about, you're going to find a way to get it. I promise you. Like, GPA, I went, through the worst of the worst, and I got myself right back up. So you can do it.
We have
And
one question in the chat too after Dr. Miraca is done with.
yes, yes.
For me, the real obstacle has been finding a practice for me that I feel comfortable in. I'm very by the book. I'm very ethical, and not everybody around you always is. It's also hard when 50% of your job relies on your team. You can be the best dentist, but if your staff's not professional or as caring, your assistant's not as great, so now you're more likely to make mistakes. It raises the stakes of the whole process. So for me, it's been important, again, to learn those leadership skills and grow within myself to manage the situation, when something can be so upsetting, like, what do you mean you didn't set this room up right? Staying calm and managing it that way. So then the outcome's the best for the patient. That's always my main concern, is that we treat the patient like they deserve to be. They can go to anyone else. It's a very vulnerable position to be in the chair as a patient. You already have anxiety. Dental anxiety is huge. I think 90% of people that come and see us have anxiety. It's a lot of money. It's pretty expensive. Healthcare is expensive. And it's not always comfortable, right? You've got your mouth open for a long time, and we've got a billion fingers in there. So just kind of making sure, managing my team, being very ethical, and also maintaining the patient's anxiety and, making sure they're comfortable has been my key. So finding an office that allows me to do that was the struggle. I'm pretty efficient, so I've learned to be very fast at things, which allows me now, I know I can talk longer to the patient, calm them down, because I can finish that procedure quicker. But that took time. I didn't come out of dental school. Something that takes me like 30 minutes now would take me hours. So just kind of allowing the process to be, and trusting in yourself and continuing to grow really is what I would consider my biggest obstacle.
And post-COVID too, I want to echo in on that. Post-COVID, you're always getting a new assistant. everyone works differently. Even if they work with other doctors too, they have to learn you, you have to learn them. You have to be patient, you have to take ownership. But understanding that it doesn't happen overnight. Like I graduated during COVID in 2020 as well. You just have to be patient. There's always going to be something, always.
Awesome. And then, well, usually what we do is we encourage discussion. So anyone who's in the, the webinar, in the beginning, to give you a little bit of perspective and kind of the history behind this, we were thinking about doing like a podcast style where, we just like record it ahead of time and post it. But then we were like, how do we allow members of our community to like be more engaged, meaning like ask the questions directly? So that's why we really value like discussion. So I want to just like briefly go over these questions that've been in the chat. The first one is for Dr. Miraka. It says, Dr. Miraka, I've always been fascinated by the holistic approach to medicine and have associated it with MDs and DOs. Could you share about how holistic principles apply to dentistry?
Yeah, absolutely. It's very similar, but it's got a lot of differences when it comes to like materials we use or supplements that we can add throughout the procedure or afterwards. So a lot of our patients have had chronic inflammation, autoimmune, a lot of allergies to certain products, and on top of it, anxiety, like most patients. So one way that we incorporate the holistic portion of it is removing amalgam through what's called the SMART system, and we make sure that the mercury or the amalgam is not congested or taken in. You don't swallow it. It involves a lot of PPE. I wear PPE, a lot of it, my hair nets, an aspirator mask. The patient drinks charcoal prior to it, and we just make sure that they feel that we're removing it the safest way possible. We incorporate ozone therapy, which is anti-inflammatory, antibacterial. Science proves that it has a lot of benefits. There's supplements that we encourage, try to reduce, honestly, the radiation as much as they can, although x-rays are very, very important and necessary to diagnose properly. We kind of take it in consideration how they feel, because at the end of the day, patient autonomy comes first. Trying to manage the legality behind that and what I need to diagnose and the patient's comfort. So those are a few ways that the principles of holistic dentistry run.
Thank you. And then there's another question here. It's actually a very interesting question. It reminds me a little bit of my father's history. Like most people in the organization, they're children of immigrant parents here in the U.S. And sometimes people have degrees in Albania, but then they move to the U.S. and unfortunately they can't right away practice. So one of our get people who are in the webinar, the Olta is the name. Sorry. They said, first of all, it's been such a lovely and inspiring meeting. I graduated in dentistry from the University of Our Lady of Good Counsel, Albania, which is affiliated with the University of Tor Vergata in Rome, Italy. So I have an Italian degree and license, and I would like to ask, how can this degree be recognized or converted in the US? I wanted to allow, both Dr. Doku and Dr. Mirak to maybe like weigh in a little bit on this.
So I've worked with an assistant that was a dentist in Ukraine. And based on his research, because again, there are different, certain schools will accept not to convert it per se, but they have like a different route. Some of them will say you have to take the NBDE and then start third and fourth year. Some will say to jump into like a specialty like perio, which is just another specialty in dentistry. But far as I know, from based on that, you'd have to contact the school to figure out what the requirements would be. Regina, do you know any different information from?
Not much. I get asked this a lot. A lot of people reach out to me for this, and there's not much online either. So I can see how complicated it
Yeah.
is and frustrating. I worked with a dentist when I first started, that she was a dentist in Albania, and I think one of the schools in Boston, I think there might only be, no, there's two in there, dental schools. They might allow you to do only 2 years.
Which is the special, either the specialty
Yeah.
or the other one, yeah.
Yeah,
And
and
sometimes schools will change it. So I'm sorry to cut you off, but
no, you're good.
there was an Albanian girl who was here and sorry, in Michigan, and they had it open for international dentists at Detroit Mercy, and then they cut it off, and then they reopened it again. So it's based on the cycle. You have to really, I would encourage them to contact the schools. With Flasim Sheep, I don't know if she understands me in English or not, but si duash, if you want me to.
Jo, jo, e kuptoj dhe të
Okay,
dyja,
okay,
s'ka
okay,
problem. Shumë
okay, good.
faleminderit për përgjigjen.
Of course.
Hello, everyone. First of all, I mean, I am really, really proud. Anytime we do the webinars, I feel this prideness to be Albanian and to hear anybody's stories. I really, really, I mean, I have the utmost consideration for you both. I had a question. Right now in Albania, I'm based in Tirana, but we have a lot of AI incorporated right now. So I had to ask, I have to ask this question. How do you see AI in dentistry in comparison with holistic approach?
Yeah, so I've been able to use in my previous job an AI system called Pearl, which helps me diagnose, and it's a useful tool as far as, you know, making sure that I didn't miss anything. I mean, I always start with looking at the x-rays by myself on my own, and then I go and check. It makes mistakes at times, or it's not something that I agree with. Holistically, AI, I'm honestly, I feel like a lot of the patients, I don't see those two clashing well together as of right now. I think the holistic way is a lot more about avoiding anything too technology, too much of anything new, and kind of just sticking to the basics. But I'm interested to see if something comes up like that.
Yeah, AI is more so because I've worked like Begina too. I've worked in corporations, private practice, meaning like it's like someone that just opens up a practice on their own, not having to do with corporations. But corporations can afford these things, so they'll purchase the AI where it'll diagnose for you, you know, where there are cavities, where there's bone loss. And more than often, they'll use those x-rays with the diagnosis and send it out to the insurances, which is helps us kind of speed things up, or maybe not us, maybe rather the people who verify things for us with the insurances. But she's right. If we look at it and AI has determined that there's something there where we don't agree with, it's used as a tool, as an adjunct, but nothing that is going to override what we see, you know?
Thank you very much. I don't know if I'm allowed, but I would like to ask also another question. This is also something I've struggled a lot. I heard both of you, and I heard a lot of doubts when you started. And I wanted to ask what helped you understand that this path was the right path, and what helped you understand how to improve what you wanted to achieve? I mean, how to achieve your goals and how to shape your personalities with a career and everything. I mean, to be. I think this also has a lot to do with Albanian excellence. How to achieve the excellence you both have achieved through failure.
So, I mean, I'll give you a simple answer. After, this is speaking for myself, of course, after you're shadowing, after you're assisting, if you go home excited and full of energy, then this is probably speaking to you that this is something that you would like to do for the rest of your life. You know, because the more you are at a dental clinic, the more you're gonna see the good, the bad, and things that you probably are like, oh my gosh, you know, like I don't know how I would handle that situation. Because like Regina said too, there's a lot of responsibility, you know? So that's personally me, that's what it was. Consistently going somewhere, like, I don't know, I'll give the example of the gym. You love the gym, you're gonna continue to go to the gym. If you don't like it, you're gonna find a way out of the gym, right? So that was my experience. And then don't be afraid to ask. So if you notice certain classmates, they're doing well, or they know people, or they have people, they have family members that are dentists, you should ask questions. Never hesitate. It's not going to be something that it shouldn't get in your way. Like you cannot be shy. You have to step away from your comfort zone, ask questions, make sure you get the right answers, and you know what? You're gonna go through some failures. But if it's something that you find that you have passion for, you shouldn't give up. Um, Anything else that you want to
Yeah.
add to that?
I'm very passionate about this because of my struggles, but what I realized is speaking to other people that are not dentists too, everyone at one point or another goes through a questioning phase. Is this for me? There's bad days. Sometimes there's bad months or weeks when you feel like you just can't catch a break, right? And you're like, what did I do? It really goes back to figuring out why you chose it and then how am I going to make it work? And in that process of like when you figure out how to get out of this bad situation, you kind of tend to find the passion again and fall in love with it. So right, I went to a point where I'm like, I don't want to do this anymore. Now I'm like, I want to learn another branch of it in a course of 5 years. So what I would do is let go of the idea, speaking to myself out loud here, of perfection. There's no such thing. No career is going to be perfect. There's not a day that's going to be perfect. So letting that go first, and fear itself. I lived in a lot of fear. Why am I going to make enough money? Am I going to be a good dentist? If you're passionate about it and everything comes from your heart and you truly do, and we say this, we were taught this in dental school, but I truly believe it. If you treat every patient like your family member, there's not much you can do wrong. There's risks with any procedure. There's risks with a lot of things, and not everything's there's failure involved, and you just accept that. But you know that when you go to bed, you did the right thing. So I think once when that all clicks and everybody has to go through their own journey, you start to enjoy it. You're like, okay, what challenges do we have today? And then you're proud at the end of the day. I'm like, I have like one thing is a prime example. Patients, my team hates when I take blood pressure at new patient exams. It was engraved in my head that we should, and I have not dropped it. Most dentists don't. I have to do it. I've had owners yell at me like, this is discouraging to the patients. They hate it. The staff, it adds time. I'm like, I'm doing it. That is like that as the doctor, I make that call. And the other day, a lady just thanked me. She goes, you didn't do anything on me. I urged me to go see my doctor. I did. And she said I could have had a stroke any minute. She cried and hugged me. And then I'm like, yeah, I struggled. I'm proving my point to everybody, but we got to the day where I'm like, told you so, or we're sticking to our gut beliefs. So things like
No,
that. Just
you're right about that. I had a patient who was in extreme pain, and I took the blood pressure. It was like 220. I'm like, no, we cannot touch this patient, because then you're responsible for it if something happens,
yep.
and you're
So
risking your license. So you got to do the right thing.
always do the right thing. And I think everything follows through at the end. I mean, people will recognize it. They might not like it, but they respect it. You don't have to always be the nice person, but always do the right thing. And I've come a long way with that mindset. 2 years ago, I would have been like, what in the world? So just kind of believing in the process, really.
this is very interesting. I worked in a urgent care a little bit during my gap year, and you see a lot of patients in the the medicine part where I went to my dentist and they told me that I have very high blood pressure and I need this resolved by Monday, and it's like Friday. Well, you can manage blood pressure in 3 days for you. So it's gonna those are difficult conversations, but I know, Dr. Doku, you mentioned in the beginning that, being able to properly deliver your message and like really pay dividends in terms of, them accepting the treatment plan that you bring to them. So it's really a great insight. And staying on the theme of insights, I want to ask a question about, you know, one piece of advice or something that you would, give to people who especially are pre-dental, who are going through the process of whether applying to dental school, or maybe they're like a sophomore or junior. What is something that you would have done differently, or you wish you would have done differently, that they can use as a learning opportunity from your career specifically, like from both of your paths? Like, what is something that you would have done differently?
I think we probably have the same thing, just being better prepared and having the right material to study, especially for the DET, the dental admissions test. Making sure that you know you're in a comfortable place to study, set up a goal, the duration, how long it's going to take you to study. Uh, and that's pretty much it. Just having the right material, because the first time when I took it, I actually did not have the right material. So I have the expectation that was didn't do so well. But I learned from that mistake.
Yeah. I would say definitely be more prepared. Like Dr. Doku, I was not all that prepared for the DAT. Thankfully, I didn't have to retake it. But another thing, most importantly, that I didn't get to experience as much because I was doing mostly front desk is be hands-on. Take the opportunity to practice and learn under somebody else's license, even in dental school, with really not many mistakes you can make, because it will help you in dental school. So a lot of my friends that were dental assistants for a long time could pour up impressions a lot faster than I could, or just have an idea about the tools that when they were brand new to me, I hadn't really interacted with the instruments or treatment planning or anything like that. They already were a step ahead. So I spent more time in the clinic. I had to work extra to catch up to their level. So just volunteer or work at an office and just get a lot of exposure to the field, as well as you will know then if you want to specialize or get ready for that part of dental school as well. Because it hits you kind of like a brick if you didn't think you were going to specialize and now you want to.
I also had a very good mentor too. Even in undergrad, I had a really good friend of mine that went through the process I just recalled. And even after, graduating and learning new procedures, having somebody that's been doing all the procedures longer than I have, giving me some clinical advice, what to do, what not to do, how to speed up the process to be more efficient, and to be better at it too. And these mentors can also guide you to take the appropriate education courses that you can take. So not all continuing education courses are going to be good, right? Like you'll find some that are, I don't want to say useless, but they're not the best. And then you'll find some that, yes, you have to pay a pretty penny for, but they're worthwhile, and you're going to be doing more procedures and having that confidence and again doing the right thing.
Yeah, I didn't have a mentor. I still struggle having a mentor. So I've spent thousands of dollars on Cs I don't even utilize, or, I just had to figure it out on my own. So having a mentor would really be helpful.
So as a pre-dental student, I have done so much shadowing, and I currently work as a pediatric dental assistant, like I said. And I've asked every dentist who I've gone to see this question. So I want to ask you guys both this question. What is one misconception people often have about being a dentist that you guys would like to clear up?
Go ahead.
A misconception?
Yes.
That we hate our job. We really don't. I love my job. And I know it, I would say about 90% of the patients that walk in and sit down, the first thing that they say begin is, I hate the
I
dentist.
hate the dentist. Sometimes I
And
say I hate being here too. Trust me. Some days I do,
yeah,
but here we are.
but no, I really enjoy it, thank God. And that's the biggest misconception. I really like it. And you can tell, like you come to my office bright and early, later in the day, you're gonna see me just, singing and just enjoying myself because I enjoy what I do.
I think I hear a lot of, they think that we're in it for the money and they think the money's big. You get paid for what you do, and it's a pretty stressful, complex job. And truly, if you are in it for the passion and you care for the patient, where nobody, and you can probably agree with me, gets wealthy and rich off fillings and filling holes in teeth. So I think the money will follow once you're passionate and people follow you. But I think that's a big misconception that, we've been often been compared to car salespeople, and I think a lot of doctors are so caring and so compassionate, and we have so much empathy, especially having dental issues in the past where we see it in our families, that it's far from the truth.
Yeah, because a lot of patients, when they come in, they will have their guard up. Now, imagine a patient coming in, you're doing work on them, their eyes closed or not. mouth open. They don't know what's going on. So if we can convey the message and explain things thoroughly and make sure that we educate our patients, then that guard is somewhat let down. And they obviously, how the work goes, it'll translate to how they feel in the end. But you got to make sure that you're very careful with them and that you let them know that you're there for them.
And being honest, like I always stick to under promise, over deliver, because if you over promise and you cannot deliver, then you're a liar that just did it for the money and you overdiagnosed. And I'm always like, I'll try my best, even though I know I could probably do it, but you never know the risk, right? So I think that's actually breaking a lot of this new generation of doctors. We're being, I think, a little more, taking more time with our patients, more empathetic, and it's changing the view, I think, on how people are perceiving us as well.
Yes, Clea, I know you can ask a question. Yeah.
Yeah, I've heard that misconception a lot actually. And I know that with our healthcare system, there's a lot of, it's a sensitive topic, but do you think that a lot of those um like concerns or like skepticism, do you think that also has to do with how the insurance system works?
Absolutely. I think so. I always say your doctor probably cares more about you than your insurance company does. So our hands are tied oftentimes. I have a lot of people that come to me, I worked in a certain demographics where income was an issue, and they come to me and say, do only what insurance covers. And when you only have $2,000 a year and your crown costs over 1,000, but you have a mouthful of decay, where do you begin, right? So I think patient education on how insurance works, how often it's more of like a little discount than anything. I take the time to do that. I'm like, I'm coming from an honest place. I'll do what you want. And, if you only want to spend this 2,000, this is my priority. This is the fire that you have going on in your mouth. Can't promise you I'll be out of pain completely, but we'll tackle it this way. And that's how we slowly gain trust. They're like, okay, now they're more willing to pay out of pocket, or, tackle one more thing.
So, I mean, oftentimes, even since I began dentistry, I honestly, I don't look at the insurance at all. I look at the x-rays, chief complaint, what they're coming for. If it's going to be a comprehensive or we're looking at everything, I go ahead and diagnose everything. Then we figure out what the payment's going to be and all that stuff, because you need to do the right thing. You need to address everything that's there. If they can afford it, if they can't afford it, that's another topic of discussion. But you have to make sure that they're educated, like Begina said, and they need to know what's going on in their mouth, because they more than likely, haven't been to the dentist in a long time.
And oftentimes sometimes we have to say no, right? We have to follow phasing. I cannot tackle something cosmetic over something like disease, because cavities and periodontitis are a disease. Most patients will come with some front tooth cosmetic issue and they've got like a rotting tooth and they're like, only do what insurance covers. I'm like, I'm sorry, I cannot start with that. Right? That's my belief. That is the way I practice. So, and most times I gain trust. They do respect that. I might lose a patient that really just wanted that little chip fixed over something else, but you have to stick to what you believe in.
And then I also wanted to ask you guys, how do you guys stay motivated and passionate about dentistry, especially during tough or overwhelming days?
I don't think about it. I don't know.
I love that. I'm different. I think about it all the time. I just love it. There's, like I said, there's so many avenues to go. There you can learn implants, Invisalign, and more about it. It's forever evolving. There's always growth. The way we placed implants 5 years ago is not the same we do it now. There's so much technology coming in. You can specialize. I mean, I've considered that at one point. So just the knowing that like you're not stuck. There's just always more to it. If you're driven and always want to study, like I think most of us are that make it to this point.
Yeah,
Yeah.
low-key nerds.
I know. I saw this meme. I was researching a little bit about the dental field because I'm someone who decided to go through the medical school path, but I really have respect for dentists for what they do, because it's something that I have some friends who are doing both. I didn't even know that was a thing. You could do MD and be a dentist at the same time, which is
For
like a
oral
very long.
surgeons, yeah.
Oral
Yeah.
surgery. Yeah.
But I saw this meme. It was like when you go to the dentist, that's that game with battleships. I'm gonna like put it here for the YouTube people, but it's like when they read coordinates, and that's how like a dentist appointment is to me. They're just gonna read random numbers. They'll say like C258, and they'll say like a bunch of numbers, and then
It's
they'll
a
make you
different
like bite
language.
on weird angles when you do the X-ray. So that was kind of my. It was really eye-opening to hear, firsthand from both of you, like what the actual day-to-day is. Um, for the respect of time, I know Dr. Doku is overseas now, so I want to again thank him for taking the time to join. But we will continue with this Q&A until around 5:10, and then we'll do some housekeeping, and then you guys both are good to go on our end. But I love talking, if you have not noticed, and I love more so talking with people who are from the same background. I really get a sense of pride. We know when I meet people who are not only successful, but they're Albanian and they're successful. On LinkedIn, I see so many people, so many Albanians who have achieved a lot, whether it is their career. And I always find this common theme that people want to help out. Like, I've never met someone who I've asked for help who's Albanian and who's a professional who has said no, I don't want to help out. Like, they're always like willing to help. So everyone who's listening, especially students, I encourage them to like please reach out to like anyone. If you see someone on LinkedIn, like Dr. Doku said, like if you live in an area, there's like a dentist office, or I know, Irena, like you need really to get hands-on experience before you apply to dental school, and that's kind of similar for medical school. But Dr. Miraka, I've seen that you've been involved a lot in the Albanian American community through your work at the Gjergj Kastrioti Scholarship Foundation. So I think it will be important for you to like maybe touch a little bit on that. Like, how did you get involved in the beginning? Like, how did that affect your maybe not your career, but your life in general?
Yeah, I'm just really proud Albanian. I can't explain it. My parents took us back a lot every, few years, and I'm truly proud to see how far Albanians have come, and to even see, your age group put this together is incredible. I think I have an older sister, so there was a lot less doctors and lawyers at her time, and as time passes, we see a lot more, which is incredible to see. I mean, we're a small country that has had a lot of struggles and a lot of corruption and a lot of distrust within one another. And to come here and see us come this far based off our parents, grandparents, aunts, uncles' sacrifices, how could you not help your own people? The Gjergj Kastrioti Scholarship Fund was something that I loved and worked with when I was in undergrad through ASO as their president. So I always wanted to join when I came back. And I did. Once I graduated, I reached out to one of the members, and he's like, all right, we're not looking for anyone new. And then eventually he reached out, and I absolutely loved those 2 years. I got to meet so many people through it, met so many Albanians members of the fund that truly care and want to raise funds for these students. Got to meet a lot of successful Albanians through it, and just it keeps me, I think, really involved in the community. So anytime I get an Albanian patient, I want to help them because I know how much they've probably struggled with their teeth too. So like just knowing our country and maybe lack of some technologies in the medical field there. So yeah.
Yeah, it's something that actually a lot of um, people who grew up in Albania, it's not, I don't want to say mainstream, but it's like dental care is kind of like they go to the dentist only when they're in pain. This like preventative care, like it's really big in the US, like going for routine cleanings and things like that. And then like just educating them on like the importance of flossing, make sure you brush properly, even your technique. Dr. Doko, I wanted you to touch a little bit on this as well, because I think it's important. When we interviewed in the beginning, when we were organizing this webinar, something that really caught my eye was your entrepreneurial mindset, like wanting to do private practice. For anyone who's a dental school student, who's maybe, like finishing dental school and they're thinking about, like getting a job. I know like when you're fresh out of school, you want to get a job, you might not have the choice to decide where to go, but like, can you talk a little bit why you chose to go to private practice, and then what are some things that maybe drew you to that aspect of practicing? So I know it's different than joining
Yeah,
one.
it is. So I mean, it wasn't done by design. I started off in a corporation like Brigina did. And the situation there was not the best on how I wanted to grow. So I maintained part-time there, and then I, went to private practice. And private practice offers like a different kind of, it's a different animal, as we say. So some will take certain insurances, or other private practices that I worked at just strictly cash, or just fee for service, meaning not necessarily cash, but you have to pay for everything. So that gave me an edge because I dealt with different patients, different kind of procedures. When you're working in a corporation, you're mainly doing uh, extractions, versus working in a different practice. Now you're doing more crowns or maybe root canals. You're saving teeth. So that kind of putting those together, when I opened up my own practice, I kind of extrapolated, got things from different ideas from different offices. So I'm like, okay, this is what I want in my office. This is what I don't want in my office, to make it a more personalized experience. There are good things that you get from corporations. They have good systems in place, because they're able to grow faster and they know what they're doing. But to maintain that touch, that's a personal touch, that's more of a private practice thing. You're not just a number. And I know sometimes, like, let's say, for instance, if someone is graduating and wants to open up their own practice, you can, some people can. I know people that have done it right off school. But I'd encourage to not do that right away, because you need to make sure you hone in on your skills, and your speed, the quality. So working in a corporation, not to say that you're doing the wrong thing, but working in a corporation, some corporations will offer you that mentorship program. Like mine offered me 3 months of mentorship program where, all the procedures that I was doing, I had someone that was there for me to bail me out. Or if it's, let's say I started a root canal and I could not finish it, somebody was there to help me get to the next phase, So not to do anything wrong, but you had that experience and somebody that can help you take you to the next step. But that's what I would recommend. And then it's nice to see, there's people are different at different offices, different locations, different cities. It's not the same. Everywhere you go is different. And especially working with um, different people with different backgrounds. So you have different patients working with certain people, meshing and all this up together. Um, you're really going to find out a lot about yourself too, you know?
Yeah, thank you. I think we covered a lot, and I really want to thank both of you because it's really, like I said, I feel very, a sense of pride when I meet people who have achieved in the US, especially in this field where it's at the end of the day, regardless if you're doing medicine, dentistry, pharmacy, anything in healthcare, it's a profession of compassion at the end of the day. Like I think that's like a good pillar. Like you're and you cannot fake being compassionate. I mean, perhaps you can, but you're gonna be miserable for the rest of your life.
Yeah.
So, like another thing that maybe listeners can get out of this is like find something that you're passionate about, regardless of what the field is, and then kind of like stick with it. I think that's the message that I got from both of you today, and I learned a lot, sincerely speaking. And then I always do like a kind of like a housekeeping. I know Irena worked really hard to like organize this, and she was so excited when she discussed about people who she wanted to invite. And then it was very very awesome for me to meet both of you in this meeting today. But Irena, I want to allow you to close this off real quick, and then I'll do like a few housekeeping things.
Thank you guys both so much. Like I said before, I was born and raised in Michigan. So I was like, I knew the panelists I wanted to pick out. I was like, they had to be from Michigan. So thank you guys for joining us today. And a special thank you to Dr. Doku and Dr. Miraka for taking the time to share your journeys, insights, and advice with us. Your stories were not only informative, but also incredibly inspiring, especially for those of us who are just beginning our path in dentistry. And to everyone else who tuned in, whether you're a pre-dental student currently applying or just exploring the field, I hope this webinar left you guys feeling more confident, motivated, and connected. And on behalf of the entire team, thank you again to our amazing panelists. And thank you all for being part of today's conversation, and that we look forward to seeing you guys at our next webinar.
Thank you, Irena. And then these are kind of like how to stay connected. Of course, in a social media age with technology being everywhere, we want to be connected. So our Instagram and LinkedIn page are on the screen here on the left side, and then our website is there as well. On our website, you can sign up to become a recipient of our newsletter to stay connected. We do a monthly newsletter with a variety of things that we're working on as an organization. We have a group me, which is informal, more so memes and kind of like joking around. And we have 2 QR codes, which are really important to us. The first one on the left, I'm not sure if this is mirrored or not, but the one that says, please fill this form out to let us know what topics or themes or subjects you would like us to work on. That is a way for you as a member of our community to give us some feedback on what you want the next webinars to be about. And then the one that lets you know to fill out our interest form if you want to join our community is essentially a interest form. It's a very long one. It's a lot of questions, but it gives us an idea of like where you are in your path and how we can best support you. So if you want to spend time, for anyone who's watching this on YouTube, you may scan both of those and then fill out the forms. That way we can stay connected. Again, this is going to be on YouTube. So I learned how to do this after doing this a bunch of times. You got to subscribe. You have to click on the notification bell and make sure you like and leave a few comments for us. Dr. Doku again and Dr. Miraka, thank you a lot for taking the time. It was really a pleasure. And I hope that we hear back at some capacity in the future. We would love to be involved, or if we're in person or something like that. But again, thank you so much, and we'll see
Thank
you
you for
next
having
time.
us.
Thank you guys so much.
Thank you. Keep up the good work, you guys.
Thank
Yeah, you guys are going to do really well on your interviews. Very well spoken.